Good afternoon, and welcome to the OSU College of Nursing Policy Hour. I'm Vanessa Jameson reporting. Today we turn our focus to Bill H.R. 3823, Disaster Tax Relief and Airport and Airway Extension Act of 2017. As a news program that focuses on healthcare policy, you may be asking yourself, why are we going to discuss H.R. 3823? Stay tuned to find out. I think you will be surprised. This bill was introduced in the House of Representatives on September 25, 2017. The sponsoring representative was Kevin Brady, a Republican from Texas, and co-sponsor Carlos Curbelo, a Republican from Florida. For bills considered non-controversial, motions may be made to fast-track debates after an initial blocking attempt by Democrats. The aid package for Puerto Rico and the U.S. Virgin Islands was increased to $1 billion, and over the next several days, the bill passed in the House. It moved to the Senate, who added an amendment related to development of private flood insurance, and the amendment was agreed to by the House without any objection. The bill was signed by the President on September 29th, and it became Law Number 115-63 on October 2nd, 2017. So let's get back to the good stuff. What does this law do? Disaster Tax Relief and Airport and Airway Extension Act of 2017 sounds like a mouthful. We are all aware of the areas of our country in need of assistance after the destruction of Hurricanes Harvey, Irma, and Maria. This law allows for several things related to this, such as eliminating the requirement that personal casualty loss must exceed 10% of your gross income before you can claim it on your taxes. It allows for the ability to access your retirement fund without an early withdrawal penalty. And it suspends the limitations on charitable giving that's targeted at hurricane relief. Now let's move to the airport and airway extension portion. This reauthorizes FAA funding with $4.99 billion to be made available through March 31st, 2018. But wait, there's more. Additional items not listed in the bill name were also included. Several healthcare programs were reauthorized. Payments to teaching health centers with graduate medical education programs. This program supports new and expanded primary care, medical, and dental residency programs in community-based ambulatory patient care settings instead of traditional hospitals. Most of the training sites are located in medically underserved communities, according to the HRSA website. Payments were also reauthorized to the Special Diabetes Program for Indians. The Indian Health Service, which is the federal health program for American Indians and Alaska Natives, has received $30 million annually since 1997 from the U.S. government to prevent and treat diabetes in American Indians and Alaska Natives. Payments to the Medicare Patient IVIG Demonstration Project were also reauthorized. According to CMS.gov, this program was implemented to evaluate the benefits of providing a bundled payment to cover the costs of IVIG home administration. And finally, also part of the bill is a reduction of funding to the Medicare Improvement Fund, which was originally established to make improvements under the Medicare Fee-for-Service program for Parts A and B. According to Lexology.com, this fund has been used to offset costs of other programs in the past. And Alliance for Health Policy states the Affordable Care Act made the fund redundant when it created a new innovation center within CMS. As we dug deeper into this bill, we discovered all of these additional provisions, things you wouldn't associate with the name of the bill. Many citizens weighed in with their opinion on the Countable website, most stating that providing hurricane relief was a no-brainer, but not understanding the need to pile on additional, unassociated legislation. Is it customary to add things Is it customary to just add anything that's up for reauthorization to a bill that's considered non-controversial, eliminating the chance for dialogue? How did the congressman confirm that these programs were still in need of funding? And who provided them with information? These are things I was unable to discover. It makes me wonder how much legislation is passed this way, and it doesn't instill confidence that legislatures are doing their due diligence. One citizen thought we needed to pass a law that doesn't permit more than one issue in a single piece of legislation. Do you think that would slow things down even more in Washington? There's lots to ponder with this one this week. Let me know what you think. Thank you and have a good evening.